This is a pre-op and what our starting point is. She's never had filler before and was really scared of looking unnatural, so I went with a filler called Revanesse, which I'll explain soon. I'm starting with the anesthetic though. I'm not using any numbing cream because I think it's shit and you can still feel the pain. Instead, I do nerve blocks where I inject very gently a small amount of anesthetic in strategic areas just inside the lip in each quarter to block out the sensation from the infraorbital and mental nerves. This way she feels literally nothing or as close as possible to nothing. The anesthetic is articaine. You can also use lidocaine as an alternative, but this gets to work a little bit quicker and doesn't last as long after we finish the procedure, so you don't have numb lips for hours and hours on end. Once that's done, we only need to wait about 20 to 30 seconds for it to kick in, and we can disinfect the skin in the meantime. I'm using Clinicept here just on some sterile gauze to gently wipe everywhere. Now for the fun part though. I'm using a cannula in this case instead of a needle because she likes the shape of her lips that she already has and just wants a bit more of what she has. I'm using something called an introducing needle to simply create a sort of tunnel through the skin and into the compartment that I'd like the filler to go into, which is the superficial fat in this case. I immediately remove it once I'm there. The cannula then travels through this tunnel we've just made and I push it all the way through to the middle of the lip and start injecting in a fanning motion between here and where I entered by pulling it back every time. I need the needle first because the cannula is blunt and can't pierce tissues. The advantage of this technique is that my instrument won't leave the tissue space I'm in and make me put filler in the wrong place. It's also really hard to put the filler into somewhere dangerous like a blood vessel, which can cause blindness at worst. Check the link in the corner if you want to see how this happens. I've used an incredibly fantastic filler here called Revanesse, and you really need to understand why if you're thinking of getting lip filler yourself, so listen very carefully. Filler choice is very, very important. Most fillers are pretty much the exact same as each other, and the only thing that makes a difference is the person holding the syringe as opposed to the syringe itself. However, for Revanesse, this isn't true. There's so many factors that make it different for a good reason. First of all, understand that fillers are made up of long chains of hyaluronic acid linked together with something called BDDE, 1,4-butanediol diglycidyl ether. But studies have shown that it can actually be toxic to us if we use a lot of it. So Revanesse have massively reduced the amount they use to prevent harm. Secondly, the HA itself is also very heavy. And this is super important because low-weight HA has even been linked to things like cancer metastasis. Thirdly, the filler particles themselves are made inside a giant liquid-filled tank, which means that they're suspended inside it like there's no gravity and have equal physical forces in 360 degrees. So when they grow in size, they grow evenly on all sides, and unlike most fillers out there, they become perfectly spherical. This is really important because if it's perfectly round, it means your body is less likely to attack it and cause things like reactions, swellings, and infections. White blood cells from your immune system are more likely to carry out something called phagocytosis, where particles which are irregularly shaped get engulfed by the white blood cell in an attempt to try and destroy it. You never have to worry about that happening with Revanesse. Fourthly, because of all that I've said, you actually get less swelling with Revanesse, so the result on the day doesn't need time to go down to see what it actually is, and you don't have to think of an excuse because people are staring at you like you've been punched in the face. When you look at all these points, you realize that Revanesse is a brand that's actually thought about what makes a great filler, not just in terms of great results, but also what works well with our bodies. The specific one I use here is called Revanesse Outline, and it's useful for an older lip because it has bigger particles for the support in someone whose lip is massively reduced over time, but because of its formulation and particle shape, it can integrate without looking unnatural by flowing everywhere as smooth as water, even with large particles. Now, I have to stress, I have no conflict of interest here or any kind of connection to Revanesse. They don't even know I'm saying this about them. All the compliments I've given for the product here are bias-free, and I genuinely, hand on heart, believe it's a great product that I gladly use on any of my patients. Choose your filler carefully and don't go to someone that uses Juvederm because it's shit. There are studies that show much higher complication rates with Juvederm, and there's absolutely no way I'd ever use it when there's great alternatives like Revanesse, Yvois, and Miley. Once we've treated all the quarters of the lip in this way, here's the end result, and I'm sure you'd agree they look completely and 100% natural with great proportions. The patient also had absolutely no swelling and no bruising at any point either. If you want to see me inject with some needle techniques instead, then you can click on the video in the corner.